I watched a man die while I stood 3 feet away in the hallway, reviewing his chart. His stroke had begun 4 hours earlier. He just didn't realize what he was looking at. Let me walk you through what actually happens inside your skull during an ischemic stroke, and why you have far less time than you think. There's a 4.5-hour window where we can still pull you back. After that, the damage becomes permanent, and the options vanish. Your brain is the greediest organ in your body. It devours half of all the glucose your system produces, just to keep the lights on. In children, the carotid arteries that feed the brain are the largest blood vessels in the entire body. That's how desperate your brain is for fuel. So when that fuel stops, when a clot shuts down blood flow, brain cells don't just die. They die catastrophically fast. Every single minute during a stroke, you lose 1.9 million neurons, not over an hour, every 60 seconds, while you're sitting there, wondering if this is serious enough to bother anyone. Let that sink in. Every minute you spend deciding whether to call 911 is almost 2 million brain cells you'll never get back. Now here's the part that could save your life. If you get to a stroke center, or even a primary stroke unit, and those exist in nearly every mid-sized city in America, within that 4.5-hour window, we can give you something called thrombolysis. It's a clot-busting drug delivered through an IV. And when it works fast. But here's the catch. It only works on fresh clots. A fresh clot is red. It's made of fibrin threads tangled up with red blood cells, soft and spongy, almost fragile. That's the kind we can dissolve. But as time passes, those red cells break down and drift away. The clot hardens. It turns white, dense, organized. And once that happens, no drug on earth will touch it. Even if the brain tissue around it is still alive, still salvageable, we can't get blood back to it anymore. The clot won't budge. That's why every minute you wait isn't just time lost. It's brain lost, permanently. The second option, if you make it to a hospital with the right equipment, is called a thrombectomy. We thread a catheter up through the femoral artery in your groin, or sometimes through your wrist, and guide it all the way up into your brain. About 80% of strokes happen in the middle cerebral artery, which supplies an entire hemisphere. We use a device that looks like a tiny stent retriever, latch it onto the clot, and yank the whole thing out. I've watched this procedure save people who walked in unable to speak or move half their body. 30 minutes later, they're hugging their kids and asking what happened. But only if they got there in time. If there's what we call a penumbra, a border zone where part of the brain is already dead, but part is still gasping for oxygen, we can sometimes stretch that window to 6 hours, maybe more. But that's the exception, not the rule. The rule is brutal and simple. Faster is better. And after 4.5 hours, your chances collapse. So let's talk about what puts you at risk in the first place. First, high blood pressure. If your pressure runs high day after day, your stroke risk climbs right along with it. That's not a scare tactic. That's vascular math. Second, plaque in your carotid arteries. You can check for this with a simple ultrasound of your neck. I've seen dangerous plaques in people in their 30s. When I was still smoking, I had my carotids checked. The ultrasound already showed early thickening of the vessel wall, what we call intima media thickness. It wasn't full-blown plaque yet, but it was heading that way. If a plaque in your carotid is blocking more than 60% of the vessel, it needs to be dealt with. Surgically. There are 2 ways to handle it. One is a carotid endarterectomy. We make an incision in your neck, open the artery, and physically scrape the plaque out like you're peeling a sock inside out. Then we sew the artery back together, sometimes with a patch to widen it. The other option is stenting. We go in through your wrist or groin, thread a catheter up to the blockage, inflate a tiny balloon to compress the plaque, and drop a stent in place to hold the artery open. It's less invasive. Recovery is faster, less dramatic. Either way, if you've got a big plaque sitting in your carotid and your doctor tells you it looks unstable on ultrasound, meaning it's soft, irregular, inflamed, you need to be on a statin. Not just because statins lower cholesterol. They do that, sure. But more importantly, they cool down inflammation in the vessel wall. They stabilize the plaque. A stable plaque is dense, smooth, and far less likely to break off and kill you. An unstable one is a loaded gun. And after 55, you should be on a daily low-dose aspirin, unless there's a medical reason you can't take it. I know there's been debate about this. I've read the studies questioning aspirin's role in primary prevention. But here's what those studies miss. Your blood has 12 clotting factors and 12 anti-clotting factors, constantly shifting in balance like a scale tipping back and forth. Aspirin doesn't thin your blood. It reduces platelet aggregation. It keeps your platelets from clumping together into a clot. You're just putting one small weight on the side of don't clot, and in a lot of cases, that tiny nudge is enough to tip the scale in your favor. I've seen it save lives. Not in a journal. In my exam room. Now let's talk about the third major cause. Atrial fibrillation. That's an irregular heart rhythm where the upper chambers of your heart quiver instead of beating properly. When that happens, blood starts to pool in a little pouch called the left atrial appendage, and in that stagnant pool, clots form. These clots are old by the time they break loose. They're white, dense, organized. They don't respond to thrombolysis. They're hard to grab even with a thrombectomy catheter. And when they finally shoot out of the heart, the first place they go is straight to your brain. If you have atrial fibrillation and you're not on a blood thinner, you're playing Russian roulette. Your cardiologist should have you on something like Eliquis or Xarelto, direct oral anticoagulants that stop clots from forming in the first place. But you won't know you have AFib unless you check. Get an EKG at least once a year. If you're over 60, make it twice. I also recommend getting an echocardiogram, an ultrasound of your heart, to see how your heart muscle is functioning and whether there's any structural problem quietly raising your stroke risk. All right, let's talk prevention. You already know about blood pressure. I'm not going to lecture you. Just understand this. Chronic high blood pressure is like running water through a garden hose at twice the pressure it was built to handle. Eventually, the hose cracks. Except your arteries are alive. They try to adapt. They thicken. They stiffen. The inner lining gets damaged, and your body patches the damage with plaque. That's how hypertension kills you. Slowly at first, then all at once. So keep your pressure under control. That means medication if you need it, and not just when you feel your pressure is high. You can't feel your blood pressure. That's the whole problem. Next, get that carotid ultrasound once a year. It's not perfect, but it's a window. It shows you in real time what's building up inside your arteries. Now, lifestyle. And I'm going to be blunt here because I spent years ignoring my own advice. Move more. A lot more. Walking for an hour every evening will genuinely change your life. I'm not talking about crushing it at the gym 5 days a week. I'm talking about a simple walk before bed. You'll sleep better. Your heart rhythm will stabilize. You'll build new collateral circulation. Your risk of plaque formation drops like a stone. We live sedentary lives. Our bodies were not built for this. Movement is medicine. It's not negotiable. And if you smoke, stop. Not cut back. Stop completely. I smoked for years. I saw the damage in my own arteries on ultrasound. Cigarettes tear up your vessel walls from the inside, day after day, pack after pack. They don't just raise your risk, they actively dismantle your cardiovascular system, piece by piece. One more thing, it's not fat you need to worry about in your diet, it's sugar. But that's an entirely different conversation. Here's what I need you to remember. If you or someone near you suddenly has trouble speaking, can't lift one arm, or has one side of their face drooping, you call 911 immediately. You do not wait to see if it gets better. You do not drive yourself to the hospital. You do not finish your coffee. Every single minute counts. Literally. And when the paramedics ask when the symptoms started, you tell them the exact time. That timestamp determines whether we can treat you or whether we're just managing the damage. Next time you see your doctor, ask for your blood pressure trend. Ask if you've ever had an EKG. Ask when your last carotid ultrasound was, or if you've ever had one. These aren't fancy tests, but most people never ask. And next week, I'm going to walk you through what happens when blood pressure isn't the problem, but your blood sugar is.